So if you have weak abdominals and diastasis recti, and it doesn't matter what age you are, you can start rehabbing your abs at 30, 40, 50, 60. It doesn't matter if your youngest is 22. It is never too late to heal your abs. But what are some things that can get in the way of you healing your abs? Well, sometimes it's a couple of weird things you would have never guessed. One is expectations. So when we talk about healing your abdominals, we are talking about improving your strength, improving your function. So diastasis recti is technically a splitting of the rectus abdominis, and that thin white line between the two rectus muscles is called your linea alba. And this is a little fascial little sheath that's very thin and strong, but when you were pregnant, your belly protruded outwards and that became stretched out. And I like to think of this as your favorite pair of jeans that you've worn way too many times and they probably need to be washed to get the taut feeling back. Once that linea alba is stretched, that tensile strength isn't going to be the same, but it doesn't mean you can't heal, you can't look good, and you can't be strong. So we've always talked about closing the gap for diastasis recti, healing the split abs. And we say that, but it's not perhaps the best option. The best option is strengthening your transversus abdominis, your obliques, and strengthening your rectus, because you will never heal your rectus abdominis without treating the rectus abdominis. And we can do that. But sometimes there's loose skin still afterwards that's sagging down. And you were thinking when you strengthened your abs that loose skin would go away. And sometimes it does, and sometimes it doesn't. Sometimes women will have EDS and they might have had such a significant stretching with their abdomen that the soft tissue is stretched and it's thinner and more wrinkly than what they want, and that's frustrating for them. But you can heal your abs, you can make yourself strong, you can make yourself functional, but sometimes the cosmetics doesn't come with that. And that's kind of disheartening. Number two, if you aren't working on strengthening your muscles with, let's say, weightlifting when you're further along postpartum, let's say like you're 6 months to a year or 2 years postpartum, and you're just doing tiny exercises, but you're not working on your generalized overall health and strength, your muscle bulk won't be thick enough in your rectus to keep the contents in the way you want to have those flat abs. So you could heal the split abs and get that rectus together, but if you're not working out, the rectus won't even be thick enough to give you that flatness that you want, that tone that you want. So generalized fitness is also important. And there are some instances, and I never talk about women's weight being a limiting factor in their healing, but I have to tell you, as a person who is perimenopause with visceral fat, my visceral fat sometimes impedes my abdominals' ability to contract because my brain says, let's fire those abs, and my visceral fat is underneath all those muscles that want to contract, and sometimes I can't get the force generated if my visceral fat is higher. It is harder. And some people have a higher rate of visceral fat if you have PCOS. And so postpartum rehab and healing those abs, if you have EDS, so you have a connective tissue disorder, and you have PCOS that's giving you all that visceral fat, and it's not to say you can't get better, but those things can put a small hiccup and stall you out slightly. But there are ways around. So with women who come to see me for healing their abs, I care about how they feel about their body, but sometimes it's not as easy as you think to heal. Sometimes it takes a little more. Sometimes it takes walking, doing some lifting, doing some cardio, and doing your PT exercises. And I don't come at women with this whole plan all at once, because depending on where you are in your healing journey, you can't handle hearing all that stuff. So it is always best to start with the basics and start with your table exercises and belly button to spine and drawing in the abdomen and doing a curl up and doing some ball and band exercises and doing your pelvic floor. But if you want more, there is a point where you're going to have to level up, and that's frustrating. Because sometimes you're so tired you can't function, and you don't want to hear that.